All right, welcome back to the deep dive. Today we're diving into something super important, especially if you're a parent or interact with kids a lot.
And what we'll be looking at specifically is the world of orthodontics and how we talk to children, particularly when they're going through treatment. It can be, well, let's face it, a little tough sometimes.
Definitely. And to guide us through this, we'll be drawing on the expertise of Dr. Shengyi Teng from Teng Smiles Orthodontics.
Right. And we're lucky enough to have two great sources to pull from. The Teng Smiles Orthodontics website, which gives a really good feel for their practice, and even more interesting, this article Dr. Teng wrote.
Oh yeah, tell me about that. I heard it was in another language.
It is actually. The article is titled Nonjutizi Junsu, which, if your Mandarin Chinese is a bit rusty, translates to the art of communicating with children, one of the keys to successful orthodontic treatment.
Wow. One of the keys to successful orthodontic treatment. That really highlights how crucial communication is in this whole process.
Absolutely. And that's exactly what we want to get at in this deep dive. We're going to try to really understand how Dr. Teng approaches communication with his young patients and see what kind of insights we can extract for anyone who works with kids.
Because let's be honest, whether it's dealing with medical treatments, explaining complex topics, or just navigating those everyday emotional ups and downs, talking to kids effectively can be a real challenge.
Definitely a challenge. And what's so interesting is that Dr. Teng starts by pointing out something very fundamental about children. He highlights how we, as adults and even as medical professionals, can sometimes miss the mark.
So what's this crucial point that we tend to overlook?
Well, in orthodontics, we spend so much time focusing on the technical aspects, getting those teeth perfectly aligned, figuring out the right bite, and creating that ideal smile.
Right, it's all very individualized.
Exactly. Each set of teeth is unique, their size, shape, the way they fit together, and we customize treatment plans accordingly. But then, Dr. Teng says, we often forget that each child's inner world, how they think and feel, needs that same level of individual attention when it comes to communication.
That's a great point. We
Well,
tailor the physical treatment, but not necessarily the way we talk to them.
exactly. And Dr. Teng emphasizes that just like teeth, personalities come in all shapes and sizes. Some kids are naturally introverted, others are super outgoing, some are fast-paced, and others take their time.
So he's acknowledging that there's no one-size-fits-all approach to communication, just like there isn't for orthodontic treatment.
Absolutely. These personality traits aren't good or bad, they're just part of who the child is. But what becomes super important is how they learn to express themselves based on those traits.
So the way they communicate might be influenced by these underlying tendencies. It's not just about what they say, but how they say it, or even if they choose to say it at all.
That's it. Dr. Teng talks about this distinction between kids who are comfortable expressing themselves verbally, using words to get their point across, and then there are those who might rely more on physical or emotional expressions. They might act out or withdraw or have tantrums.
And he suggests that the way adults interact with kids can actually make it harder for them to use their words effectively. Isn't that fascinating?
It is. And he gives some really striking examples of how well-meaning parents can actually hinder their child's communication without even realizing it. Like there's this one story about a mother who's constantly speaking for her introverted child.
Oh, I can imagine, like before the child even has a chance to answer a question.
Exactly. And I'm sure the mother is trying to be helpful. Maybe she's worried the child is shy or taking too long. But the unintended consequence is that the child never gets a chance to practice finding their own voice.
It's like they're being robbed of the opportunity to figure out how to put their feelings and thoughts into words. And that's a skill they're going to need throughout their lives.
It is a crucial skill. And he also talks about parents who are quick to defend their children, maybe without even fully understanding what happened, or those who are constantly pitying them.
I can see how that would undermine a child's sense of agency, like they're always being seen as fragile or needing to be protected.
Exactly. And on the flip side, he talks about parents who are overly critical, constantly scolding or judging, which can create an environment where kids are afraid to speak up at all.
It's like a lose-lose situation. Either the child is being spoken for or they're being silenced.
Yeah.
And then Dr. Teng gives another example about a really strict father.
Oh, yeah, this one really stuck with me. The father had very strong opinions and didn't leave much space for the child to express their own feelings or thoughts.
So the overarching impact of these communication patterns, according to Dr. Teng, is that children miss out on these crucial opportunities to understand their own inner world and articulate it to others.
It's like they're missing a key piece of the puzzle when it comes to understanding themselves and interacting with the world. And there's this really powerful story Dr. Teng tells. to illustrate this point. It's about a child who was labeled lazy by her mother.
Lazy. That's a pretty harsh label to put on a child.
It is. And in this case, the mother was using it because the child wasn't following her orthodontic instructions. She wasn't wearing her rubber bands consistently, or she wasn't brushing properly.
And I'm guessing Dr. Teng didn't just take that label at face value.
Oh, he didn't. He felt it was crucial to hear directly from the child, to understand her experience. And sometimes that meant asking the parents to step out of the room so she could speak freely.
I could see how that would create a safe space for her to open up.
Yeah.
So what did he learn from the child? What was her perspective on this whole lazy label?
Well, what she said was really eye-opening. She explained that she was slow, that she often forgot things, and that made her think she was lazy because that's what she had been told. But she didn't actually understand the real meaning of the word.
So she thought lazy meant being slow or forgetful, not necessarily choosing not to do something you know you should.
Right. She wasn't intentionally being defiant or disobedient. She had different challenges that were making it difficult for her to follow through.
And Dr. Teng realized that this child didn't need to be labeled lazy. What she needed was patience, understanding, and encouragement tailored to her individual needs.
It's a perfect example of how jumping to conclusions and applying these adult labels can completely miss the mark when it comes to understanding a child's perspective.
So what are some other ways beyond this specific case that a lack of verbal expression can show up in children? What has Dr. Teng observed?
Well, he says that when children don't have that outlet of language, when they haven't developed those communication skills, their feelings often find other ways to express themselves.
So it's like their emotions are bottled up and they need to find some release.
That's a good way to put it. He says it can manifest physically, like holding everything in, becoming tense, or even acting out physically, almost as if their body is doing the talking for them.
I can see how that would be the case. And emotional.
Emotionally, he talks about increased anxiety, frequent tantrums, these big emotional outbursts that can be really difficult to manage. And it's because they don't have the words to process what they're going through, to communicate those feelings to the adults around them.
So essentially, Dr. Teng is saying that verbal expression is absolutely vital for children. It's not just about being articulate or well-spoken. It's about having the tools to understand and navigate their inner world and share with others.
Yes, exactly. He believes that when kids can express themselves verbally, it opens up a whole new level of understanding. Adults can better understand their feelings, their thoughts, their needs, and that allows for much more effective communication.
We can respond to them in a way that's actually helpful, instead of just guessing or projecting our own interpretations onto their behavior. And in the context of orthodontics, how does this play out specifically?
Well, think about it. If a child can tell their orthodontist that their braces are hurting, or that they're having trouble with a specific appliance, or that they're scared of a particular procedure,
Then the orthodontist can actually address those concerns, adjust the treatment plan if needed, and reassure the child in a way that makes sense to them.
exactly. And it builds trust. The child feels heard and understood, which makes the whole treatment process much smoother and ultimately more successful.
But like we said earlier, these principles go way beyond orthodontics. They apply to any situation where adults are interacting with kids, especially when those kids are facing challenges.
Absolutely. Think about helping kids with schoolwork, dealing with social conflicts, navigating those tricky emotional moments that are part of growing up. Being able to communicate effectively is crucial in all of those situations.
And to give a bit more context about Dr. Teng and his practice, his website mentions that he's been practicing in Bellevue and Seattle for over 20 years. That's a lot of experience working with young patients and their families.
It is, and the website also details the wide range of services they offer for kids, teenagers, and adults. They do Invisalign, traditional braces, the whole spectrum of orthodontic treatment. And one thing that stood out to me was a patient testimonial that mentioned the staff being multilingual.
Oh, that's interesting. Which languages?
The testimonial specifically mentioned Chinese and English, and they said it was a huge plus in terms of feeling comfortable and understood during treatment.
Especially given that the article we're talking about is in Mandarin Chinese,
Yeah.
it suggests that they really value being able to communicate clearly with a diverse range of families.
It definitely reinforces Dr. Teng's emphasis on communication. So, as we wrap up this deep dive, what would you say is the most important takeaway from exploring Dr. Teng's perspective?
I think the key message is that communication isn't just about talking at kids. It's about creating the space for them to talk to us, to express themselves in their own words. And that requires us as adults to really listen, to be patient, and to try to understand their perspective, even when it's different from our own.
And to remember that all kids are different. They communicate in different ways, and those ways are shaped by their personalities, their experiences, and the way we interact with them.
So as you go about your day, our listener, we encourage you to think about how you can create those spaces for open communication with the children in your life.
Yeah.
How can you encourage them to use their words, to share their feelings, and to feel heard and understood?
Because ultimately, as Dr. Teng's insights show us, effective communication is about so much more than just getting our point across. It's about building connections, fostering understanding, and empowering kids to navigate the world with confidence and resilience. And who knows, maybe we can all learn a thing or two from the way orthodontists approach these communication challenges.
That's a great point to end on. Thanks for joining us on this deep dive, and we'll see you next time.